Arrhythmia. Arrhythmia is any abnormal pattern of electrical activity in the heart. Normally, the waves of depolarization follow a specific sequence, starting in the SA node and ending with the contraction of the ventricles. Arrhythmias are divided into two general groups, those that result in an increased heart rate and those that result in a decreased heart rate. It is further subdivided into groups according to the location of the ectopic foci or the lesion causing arrhythmia. Antiarrhythmics are agents used to control ectopic foci or reverse disorganized conduction of electrical impulses through the heart. Although research has provided some information of the mode of action of antiarrhythmic drugs, the general approach to therapy remains empirical. Classifications of antiarrhythmic drugs. First is the Class 1 drugs. Class 1 drugs act by blocking the sodium channel. They are subdivided into subclasses 1A, 1B, and 1C, whereas subclass 1A drugs have moderate potency at blocking the sodium channel. Subclass 1B drugs have the lowest potency as sodium channel blockers, and subclasses 1C drugs are the most potent sodium channel blocking agents. Second is the Class 2 drugs. Class 2 drugs act indirectly on the electrophysiological parameters by blocking beta-adrenergic receptors. Example of this is propranolol. Third are the Class 3 drugs. Class 3 drugs act by mechanisms that are not well understood, but act to prolong repolarization, with little effect on the rate of depolarization. Last classification are the Class 4 drugs. Class 4 drugs act by blocking the voltage-sensitive calcium channels. They slow the conduction in the SA and AV nodes where action potential propagation depends on slow inward calcium current.